Comes to your healthcare, it is never wrong to ask questions. That's always a good thing, to find questions about your primary care provider, about how they work with their billing, and all sorts of other things. And today we are live at Kohif Tailor Health on the corner of Highway 92 and Canyon de Flores in order to answer your questions. We've met with Dr. Kohif many times over the course of the last several months, and we've had questions from the audience, and we're actually opening it up to you today. So if you have questions about healthcare in general or how healthcare works at Kohif Tailor Health, this is your opportunity. So again, at the corner of Highway 92 and Canyon de Flores, Kohif Tailor Health here. Dr. Kohif, always a pleasure to see you.
Me too.
Thank you so much for your time. Isn't it good for people to ask questions when it comes to their health?
Absolutely. Especially when it comes to something completely new, like, for example, the healthcare model or ecosystem. I like to call it the new healthcare ecosystem, that it's not based on insurance coverage and it's not a one-size-fits-all care. So definitely, we're always happy to answer people's questions because, people are always, I would say, interested in learning more about this new type of model. And that's what we're here for. So,
and we have questions. So the questions have lined up. We'll get to the insurance side of it. And again, if you're just joining us, this is your chance to ask questions in the live chat. Well, we'll take time to answer your questions as well. We might cover them here. You can see the questions that we're asking in the post description. So if those questions are ones that are on your mind, then we'll hopefully address those right now. For instance, who is on the care team at Kohif Tailor Health? The MDs, the FNPs, PAs, etc.
Absolutely. So there are two, I would say, models we have in place at Tailor Health. The first model is a precision medicine model, meaning that you can keep your primary care provider or your specialist in place, and then you can use us as the precision medicine or personalized medicine experts, meaning that we will be the ones that help you and your healthcare provider to, navigate complex genetic data, interpret those genetic data and results, do the test as well for you, and combine it with the other factors when it comes to precision medicine. We talk about genetics, lifestyle, environment exposure, drug interactions, comorbidities, many, I would say many things, many factors. So this is the first model. So again, you can keep your primary care or your specialist or your doctor and use us for that. Or you can actually use us as primary care. And when you use us as primary care, we're still going to practice precision medicine, but then our primary care providers. And people asked before, so do you actually do primary care services? We're like, yeah, sure, we do. And all our primary care is delivered through licensed healthcare providers. We have MDs, FNPs, and so on. And they are trained in navigating these precision medicine and complex genetic data.
And we've also talked before about how you have them on site and via Zoom, the virtual side.
Yeah,
as
so
well.
we do have both models. On the website, you can easily book a virtual visit, or from the comfort of your home, you literally go and meet with one of our providers or experts. Or you can come on site here in Sierra Vista. We have people from Sierra Vista, Benson, Tombstone, Bisbee, the surrounding areas so far. We actually have some people from Tucson, which was surprising.
Wow, that's great. Well, but it shows the power and reach. And by the way, the website is in the post description. So as you're watching this, and we're doing a Q&A with Dr. Kohif here at Kohif Tailor Health, if you have questions about the healthcare model or the system that is used here, we have John behind the camera monitoring the chat. So if you have questions, please feel free to ask them as we're answering these. So we talked about the team who's a part of that, the doctors, the nurse practitioners, physicians, assistants. Let's talk about...
Yeah, sure. So, and I forgot to mention also that one thing unique about us is it's not just the primary care providers. We actually have something called the Precision Medicine Board, and you'll never find anywhere, wherever you go. That board includes, the providers, but with them, we have molecular geneticists, and we also have clinical pharmacists trained in genomic medicine. They all gather together actually and work on cases, based by, individually.
So it is a huge team effort that you won't find at any other practice in Arizona, much less Southern Arizona.
Yeah, because the goal here is we're not just trying to put people on medications. It's actually the other way around. We try to take people off medication as much as possible. We don't want to see people on 5, 10, 15 medications. That's not good, Right. So we really try to go deeper, I would say, into the root cause of whatever they're going through. If it's a medication interactions, we will guide them through. If it is something genetic, we can discuss it with patients and things like that. So it's not just primary care, traditional primary care. No, here we're not about maximizing volume or profitability. We're actually doing all of this, in the backstage just for people, because it's 100% quality driven care. And this is why we'll come to insurance.
Tailored to the individual, through the genetic testing side and working through it that way. Let's talk about pricing options right before we get to not working with insurance companies. Let's talk about pricing options. So when someone goes to the website or they stop by or they call and they make an appointment here, let's talk about the pricing.
Yeah, absolutely. So the first visit is always going to be free, virtually or on site. That's free. And we discuss services and also see what option is best for you, right? But then if you, would like to proceed and opt in with us, then we have, again, depending on the model, if you want to use us as primary care or you want to use us as precision medicine. And by the way, we are hiring new primary care providers as well, MDs and FNPs soon as well.
That's exciting.
For Vista clinic. Yeah. So, in terms for the primary care visits, it's always going to be between $49 to $99. That's it. It's never going to be more than $99 that you pay here for a primary care visit.
Amazing.
And as for the genetic test, which cost, again, thousands of dollars, with us, we do have tiers and plans in place that makes it very, very affordable for people. Very affordable. So, it's starting at $99 all the way to $599. And then you have all these different genetic tests, not just one genetic test. You're talking about around 90 genetic tests combined together. And again, it's not just the genetic test again. It's the genetic test with the consultations, the interpretation, the guidance, all of them. All of these are included within that price. So
it's absolutely amazing. Again, the options that you have that are extremely affordable.
Yep.
Now, the question always comes down to insurance. And again, we're live with Dr. Kohif here at Kohif Tailor Health at Highway 92 in Canyon de Flores. If you're just joining us, we're doing a Q&A session here. So if you have specific questions about healthcare or the way that genetic testing or things like that work here at Kohif Tailor Health, John will keep an eye on the live chat. And if there are questions, he will let us know and pass them along our way as we're going through this Q&A here. Insurance, that is something that every single person, we've been trained. We talked about before we went live on the air about how especially here in America, we've been trained to use insurance companies and how they provide a fine service.
Yeah, sure.
But here at Kohif Tailor Health, what are the benefits of not using insurance companies?
Well, first of all, we're not against insurance companies whatsoever, right?
Exactly.
So, and we're not against in other practices. We respect them. Mm-hmm. They do a wonderful job. But for us, to be honest, there are some challenges when it comes to insurance. First of all, genetic tests usually are not covered by insurance. So there is always going to be denials, surprise bills, and patients don't like that, right? Second of all, insurance sometimes have restrictions in place that wouldn't allow us to practice care based on what the patient deserves, in terms of coverage and things like that. And this is why we're completely changing healthcare, not just clinically, from a one-size-fits-all care into a tailored, unique one, but also the financial model. We believe that people, no matter what, they have insurance or no, they still can get an affordable care, and not just any care. A care that is going actually to be, I would say, 100% of care here is quality-driven. Really, really. The system that we built in place, that's amazing. It's not centered around insurance and billing and coverage. It is centered around quality. 100%. So again, this is why we don't work with insurance, but because we do not work with insurance, we understand. We're not just gonna, we don't want people to come here and be seen for $500, $600. No, that's too much. No, this is why we have it very affordable. $49 to $99. That's usually what you pay, less than what you pay sometimes with insurance.
Exactly. And that's what Patricia just said. She makes the point of saying insurance companies most likely won't cover this, but that's what you just addressed.
Yeah, exactly.
And being able to say that.
Yeah, so I can give an experience like before. A couple of years back, I was with a genetic testing clinic and company. And then usually when you tell patients, hey, you know what, we accept insurance. And then, okay, patients are going to expect that it's going to be covered. But then actually you're going to be, most of the time, I would say over 90% of the time it's going to be denied, let alone the time wasted and the headache and the prior authorization, all these things.
Right.
But then now when it is denied, now the provider is left with the patient, and the patient is left to pay thousands of dollars. And of course, no one is going to be able to afford that, right? So, and this is why working with insurance, especially for this type of care, is not going to be for the patient benefits. I mean, I don't want to name some companies, but the biggest genetic testing clinic and the biggest genetic company 2 months ago, actually, they shut down for the same reason.
Wow.
So we understand this, and this is why we have these affordable options. We don't do the genetic test here for thousands of dollars. It's really, again, it's as $99. This is the basic, combining with it, the visits, the interpretation, the consults, the shipping, everything with it. I would say it would be at $299, and then all the way to $599 if you want to have that comprehensive coverage for all the genetic tests.
Right, and again, that would normally cost thousands of dollars if you went anywhere
absolutely.
else.
Yeah.
But here at Kohif Tailor Health, on the corner of Canyon de Flores and Highway 92, these are the questions and answers that come up, and a lot of it does have to do with insurance companies. And like you just said, it's nothing against the healthcare model or the insurance companies themselves or other practices that use insurance, but for the specific goals of the genetic testing, it's it's going to get denied. So why go through the hassle and just pay a flat fee to come in with, the first appointment being free to stop by and see you and the team.
Sure, absolutely. Here. Yeah. And I would say what we're doing is an upgrade, if that makes sense.
Yeah.
We're trying to keep up to date with the most advanced technologies. I mean, again, one of the genetic tests, we see the difference, and that means everything to us. I mean, when you see a patient here, and for years they've been, jumping from a clinic to another, trying to find answers, but then no one is able to provide those answers to them. But with us, with what we do in place, we're able to dig, deeper into the root cause of whatever the patient is going through, and then provide answers to them.
And that's actually leads me to my next question about success stories of patients that you've had here. Again, knowing that with the combination of genetic testing, being able to look at them as a whole individual. This is not one size fits all cookie cutter medicine. This is tailored health. So the success stories that you have of each individual, it is on an individual basis.
It is.
And I'm sure there's countless ones that
it is. I mean, I can give a few examples. For example, we had a patient that their kidney deteriorated from, I think, 40-something% all the way to 23%.
Oh my goodness.
And in the matter of 3 to 4 weeks.
Oh.
And then, they came to see us, and then we did everything, not just, again, the genetic test, because again, what genetic reductionism. No, genetics is a piece of this big multifactorial puzzle that includes lifestyle, diet, all this kind of stuff as well. So, but yeah, I mean, after we, evaluated the situation, we did some genetic tests for him and combined it with the medication profile and the interactions we have in our system. Then we figured out that it was just some medications clashing together, causing all side effects and kidney damage. And in the matter of 4 to 6 weeks, he was able to get his kidney function back to 42%, and he avoided going into kidney dialysis. Wow. This is one patient. We have another patient with blood pressure again. Their blood pressure is over 140 or 50, and they're young, in their 30s, not really, 50s or 60s. So 140 over 90, 95. And again, it was something called phenoconversions that we practice in place, meaning that sometimes you take some medications or herbs that are actually inhibiting the genes that metabolize that medication, process that medication. So this makes you look like if you're deficient genetically. So when we actually combine the insights, we were able actually to figure out that, remove whatever, the medications were causing that to happen. And then their blood pressure in 3 days started going back to, I think, 115 over 75/80, which is normal.
All because of figuring out that some herb that they were taking counteracted a medication that caused their blood pressure to increase and go higher.
As simple as this.
That's amazing.
It could be that,
and again, we're answering live questions here on Cool FM Live. So glad you're joining us. Carla has a question saying, does their genetic testing test for autoimmune disease and treat?
That's a very good question. I mean, when it comes to genetic tests, we do have many options in place. Okay. The pharmacogenomic test, for example, what it does, it covers the medications within these different specialties. Autoimmune disease, Sjogren's syndrome, and many autoimmune diseases are one of them, honestly. But I want people to understand the difference between genetic tests that guide medication selection to avoid side effects, adverse drug reactions, ineffective medications, and things like that, from genetic tests that test actually for the genetic disease that tells us if a patient is in risk to develop.
Almost like the BRCA1 gene inside for breast cancer. Yeah.
Exactly.
Okay.
So those ones are expanding now. Within 2 months, we will actually have them, and we're going to have a big one for cancer.
Oh, wow.
That actually I think is going to be the first in Arizona probably, which tells us how, based on your tumor, what exactly is driving your tumor or your cancer, and then target it with a specific genetic-based medication.
Wow.
That's a whole new field. But yeah, again, so the pharmacogenomics guide medication selection in more than 17 specialties, including autoimmune disease. But then there are genetic tests that tells us if you're in risk to develop that disease. That's a whole different story.
Yeah, that's a great question, Carla.
To
bring that up and get that clarification and know that even as technology advances, you're doing the same thing here, advancing Kohif Tailor Health.
I mean, also to answer the question, one part I would like to mention is there's a test called nutrigenomics that we perform here, and it deals with a lot of things like diet, nutrients. But actually, a big section of the test, it tells us if you're in risk to develop like celiac disease, gluten sensitivity, caffeine sensitivity, salt sensitivity, if you're at risk to develop insulin sensitivity and type 2 diabetes. I mean, it's really comprehensive. So
wow,
and that's
already there,
and that's on the prevention side of things, right? Yeah. Because we have most of the time we get patients after the facts, so we're prioritizing prevention, but then that's not the case. I mean, you get patients on tons of medications or tons of chronic conditions and illness. So we're not going to say, okay, well, we prioritize prevention. So no, of course we're going to step in and help these people, take them off medication as much as possible, but also we're going to guide them, take preventative measurements to their health. That's the big goal actually for us. Eventually, we will be happy if somebody comes to us for 1, 2, 3 times, and then they don't need to come or see a doctor anymore. We will be happy, because that's what we actually need. We're not about maximizing volume or profitability at all. So
it's about the tailored health for you. And that's why we're doing this Q&A live right here with Dr. Kohif at Kohif Tailor Health on Highway 92 and Canyon to Flores. Thank you for the live questions that are coming in the live chat. John is monitoring those for us, and you can see the questions. If you're just joining us, we've answered 4 questions already, and then 2 more from the live audience. And we've got 1 more here on my list. And this is the big question, because as people watch this, they wonder, okay, and we did address this at the very beginning, talking about the differentiations of what happens with what makes this Kohif Tailor Health different from other primary care providers.
Yeah. So again, we respect all other PCBs. They're doing a wonderful job for the community.
Right.
I mean, I used to practice in primary care, back in the years. So, but the difference I would say is the traditional approach always is probably going to be giving medications, guessing, trial and error medications and things like that. But here no guessing no more. Meaning that the moment you come in, especially when we do the genetic test and then take all these different factors into consideration, then we're going to be able to actually tell what medication is most likely going to work for you, what medication is going to cause side effects, adverse drug reactions, immunologic reactions. I mean, it is not going to be effective for you. So we avoid that. I mean, it's huge when it comes to some specialties like psychiatry, for example. Because one thing I would like to tell people is people on those who are on, I would say, anti-psych meds, ADHD, anxiety, depression, whatever it is, usually those medications start working in 8 to 12 weeks. So imagine you take a medication, you wait 8 weeks, but then it's not for you, and then you have to restart a new medication.
Oh my gosh, I didn't even think about that.
And I mean, and that's what's cool about here. Here we can actually tell, not 100% again, the human body is complicated, but I mean, we have insights that others probably don't have.
Yeah.
So we can tell you, looks like this one is probably most likely going to work for you. This is so, of course, so we guide.
And you don't wait those 3 months to find out that it doesn't.
Yeah.
You have a better opportunity to be able to find an effective medication for whatever you're facing.
Yeah.
And that's a massive, we do have a couple more questions that have popped in. Bobby Ann asks, do you have or make recommendations to address cholesterol naturally and to clear plaque in arteries? So natural ways to address the arterial deterioration because of plaque.
Yeah, I mean, that is going to be on the nutrigenomics side of things, meaning that test tells us, it's all about prevention, I would say. So, for example, it tells us what food, diet, and nutrients that your body needs to avoid things like that, like artery blockage and things like that. Sometimes it would recommend like, hey, you need olive oil, for example, maybe you're supposed to avoid, certain type of fats that might cause this. So definitely that's going to be helpful for something like this, the nutrigenomics. It tells us also if you have deficiencies for certain vitamins and supplements that are needed for, I would say, for arteries and veins to be in good health and good conditions. I mean, yeah, definitely. So that can help with that.
That's a fantastic point. And then Carla also asked a question about do they test on children as well as adults or just adults?
Absolutely. Actually, we do have actually an example. We have a kid with ADHD, and then they were prescribed the ADHD medication, atomoxetine. Atomoxetine. But then he was taking the dose, the normal dose. That again, that's like based on the average patient. But then when we did the test, we found that it was deficient in that gene, and we were able to actually reduce the dose. It helped tremendously. He was having side effects, heart palpitation, things like that. And I think his mother prescribed to us the teacher. He was completely a different kid. And that's actually a real story. So
again, more success stories of being able to use genetic testing to find out the medications that are right for the issues that we have.
Yeah, and this is just one side of it. I mean, but also on the other side, prevention, like what diet is working for you. If you're at risk to develop certain things, again, so it's if you're on medications or you need to be prescribed a medication, it's not going to be guessing or trial and error. Yeah. So,
and again, this is a live Q&A session here with Dr. Kohif at Kohif Tailor Health on Canyon to Flores and Highway 92. The questions that we have answered are in the post description itself. And then you can see in the live chat the other questions that have been asked by our viewers as we are live right here on Cool FM Live with Dr. Kohif. And in addition to the information that's there in the post description, we have their website where you can learn more. You can always go to the website to learn more, and you have the frequently asked questions that come up just from looking at the website and understanding the differences of Tailor Health versus healthcare and the system that we're used to here in this country, and the way that we've thought. It's kind of like we've been inside a bubble, and then Dr. Kohif comes along, says pop, and just pops the bubble and says there's another way to look at it.
It's true. And I one thing I want to say that I appreciate people's support so far, and people understanding what the sacrifices, honestly, we're going through to actually make this happen, to completely change the healthcare, not just clinically, even financially. And that's actually back to the question you asked about what differentiates us.
Yes.
Again, I mean, like, no more one-size-fits-all care here, but then here, you will actually see experts and even providers that spend most of the time with you. So that's one of the things, again, when it comes down to insurance restrictions in places, we don't have those restrictions. We have people who come actually for 15 minutes, but then they need like 30, an hour. That's fine. So we actually spend most of the time on your care, not on admin things that probably, and again, one part of it is our EHR system, because we built actually this innovative EHR system in place, and it's the only EHR system currently where actually it innately integrates these different precision medicine data, like including complex genetics, genomics, drug interactions, comorbidities in place. That's what's unique about us as well. So it's not about maximizing profitability, billing, and things like that. No, it's all about quality. So
tailored health, tailored to you, tailored to your family. It's a family practice where, again, it's adults, it's kids, it's everybody in between here at Kohif Tailor Health. I don't see any more questions popping in right now, but I mean, my goodness, we've answered so many. I'll hand the phone back to John here. And again, I mean, just being able to take this time for a live Q&A here. It's so important. And again, no matter where you are being seen for your healthcare, it's never wrong to ask questions.
Yeah, absolutely. Especially when it comes to this type of new model. And I mean, we understand that, again, because of the bubble that you just talked about. And but so far, I would say that we have many success stories. And I mean, we as human, it's a human nature when you step into something that's new. You're going to be hesitant initially, of course. But then when you try it and you see the difference, that's when you're, okay, so it will make sense. So.
And to take those steps and understand a little bit more. And you can schedule an appointment with Dr. Kohif. You can do that on their website. You can call. All the information is in the post description. And we encourage you to do that. It's a different way of looking at something that we all deal with. We all have healthcare needs, but being able to combined with genetic testing as well as a primary precision care practice, bringing those things together here at Kohif Tailor Health on the corner of Highway 92 and Canyon to Flores here in Sierra Vista. getting patients from all across the county, even up in Pima County. If you're watching this in Pima County right now, we would encourage you to share this with your friends, with your family members, and let them know these
Your
answers.
doctors as well.
Yes, why not? You know, let everybody know. And again, and that's the other side too. You don't need to leave your current practice that you go to come here for the genetic side, because that will end up helping you with your current primary care as well. This is in addition to, it's not and or. It's
we collaborate with providers. They refer patients to us. I mean, there are wonderful providers in Benson as well, not just in Vista. Honestly, they refer patients to us, and we work with providers. We're not against the system completely, you know. But again, it comes down to the two models. You can keep your primary care provider and use us for the precision medicine side of things, or you can use us as primary care as well. And again, we're hiring new providers soon for the Sierra Vista clinics, virtually or on site as well.
And Bobby Ann, before we go, we'll have one more question here from the live audience. Bobby Ann asks, so, and we did cover this, but we're happy to do it again. Is there a network of healthcare specialists you see through video appointment or telephonically? We did address that there is options of in-person and virtual.
Virtually, you can do it virtually, and it should be on the website. When you go to book, you will have two options. I think you will have the free 15-minute virtual consult, and then you will have the on-site on-site visit, 15 minutes, and it's free. And again, we're doing this because we understand this is new, so it's completely informational, educational. But then you don't have to opt in for anything. I mean, you know, just to explain what it is all about. But again, one thing I would say at the end, this is primary care, and just like in primary care, meaning that you can meet with primary care providers who prescribe meds, diagnose, treat, and everything. But again, instead of just treating you based on the average patient, no, it's actually going to be treatment that's tailored based on your own genetics, your own lifestyle, your environmental exposure, medication profile, medical history. I mean, you name it. All right, because we're all unique. Just like we customize clothes to fit our body, that's how care should be customized. It shouldn't be, a cookie, It's not right. No. So and thank you so much. No. I really appreciate your support.
Of course.
I appreciate people trusting us so far. I mean, we have wonderful people so far from not just Service again, from Cochise County probably, and from Tucson, surprisingly. And we actually had 2 patients from Phoenix virtually as well.
Okay. Well, and that's the important part too, is the virtual option is there for people outside. Yeah, telemedicine being outside of the Sierra Vista area, or maybe you're in the Cochise County area and not able to come in person. That's why using technology in a great way to help customize.
And HIPAA compliant, secure. And one thing, Jeff, I would like to address. Some people say, we understand, like you guys sell our data, and we're like, we don't even work with insurance. It's so, come on. We're never going to share your data with anybody. It's us and the lab. And then only the healthcare providers involved in your care. That's it. We use your data internally to develop guidelines and care for you, of course, but we don't sell it to pharma companies. We don't sell it to insurance companies. None of this. It's completely secure. And there's no such 100% security again, but we have everything, we're taking all the means in place to protect your data and your security with our wonderful software engineers that actually we have in the backstage that are working on this amazing system to be able to keep up with the most, I would say, advanced guidelines when it comes to healthcare. So
protecting your privacy, making sure that is the utmost of importance, and then tailoring the healthcare directly to you. That's what Kohif Tailor Health is all about. Dr. Kohif, thank you for your time today.
Thank you so much.
As always, it's so great to see you. And you can learn more about Kohif Tailor Health when you check out their website. In the post description, you can see the questions that have come in, the questions in the post dialogue itself, or in the dialogue with the active viewers of this.
You can just call us as well.
Yeah, you can call, stop by, and learn more. The free 15-minute exam is waiting for you at Kohif Tailor Health to learn a little bit more about this. And please remember, it is never wrong to ask questions about healthcare and understand that the answers are there. The answers are here for you, for your family at Kohif Tailor Health. Thank you so much for watching. Thank you for sharing this video around, and please feel free to tag your friends and family members who are looking for a primary care provider, possibly looking at primary precision care, understanding what that is. And you can learn more about that in the website, in the post description. Thank you so much for being a part of this interactive Q&A here on Cool FM Live with Dr. Kohif at Kohif Tailor Health on the corner of Highway 92 and Canyon de Flores. Have a great day, everybody. Stay healthy and keep asking those questions. They'll be monitoring the questions in this chat if you're watching after the fact, or you can go to their website to learn more. It's all in the post description. Thank you again for being a participant in today's Q&A. Have a great day, everybody. We'll talk to you again soon. Thank you so much.